As a provider, using the Levo system, there's really not any issues I've come across. There's no major difficulties. It's once you learn the system and using how to use the manager and transferring the therapy to the Levo device for the patient, I honestly haven't really had any problems at all. For a patient, the most difficult thing I've seen using Levo is understanding that it is a marathon, not a sprint. It is not going to be a quick fix. There's no cure for tinnitus, but knowing that in the long run, you're going to see some relief if you're a true candidate and reduction in their tinnitus. That's the biggest thing, is knowing it's going to take more time than they probably want.